vegan leader, exemplary leader.
Our programs offer many languages. Please visit suprememastertv.com/schedule.
Nos programmes offrent plusieurs langues. Veuillez visiter suprememastertv.com/schedule.
Nuestros programas ofrecen varios idiomas. Visiten suprememastertv.com/schedule.
ਸਾਡੇ ਪ੍ਰੋਗਰਾਮ ਪੇਸ਼ ਕਰਦੇ ਹਨ ਅਨੇਕ ਭਾਸ਼ਾਵਾਂ। ਕਿਰਪਾ ਦੇਖੋ suprememastertv.com/schedule.
So we're talking about a diet that's centered around whole plant foods. And then there's certain foods that you should really up in your diet if you want to particularly reduce your risk of breast cancer. And those would be soy products, whole soy foods.
Continue watching to find out more.
The people of the Kingdom of Tonga would like to say Malo elele to visitors, meaning hello in Tongan, one of the official languages. Delightful viewers, my name is Taina. The joyful people of this Pacific Island nation wish that your life shines brightly in the eternal light of God's glory. Getting access to genuine and truthful information regarding our health is a welcomed blessing. And we are indeed blessed to have with us today Dr. Debra Shapiro, an esteemed American medical doctor specializing in the field of women's health. Welcome to our program, Dr. Debra Shapiro, Vegan, Champion of Women's Health, Part 1 of 3. Dr. Shapiro is a board-certified obstetrician and gynecologist and has been practicing medicine for nearly 25 years. Having been constantly reminded by those struggling with chronic illnesses that are often reversible and lifestyle-related, Dr. Shapiro broadened her expertise by advancing her knowledge in plant-based nutrition and obtained a certificate in the area through the T. Colin Campbell Center for Nutrition Studies and D. Cornell. Apart from helping patients as a specialized surgeon, Dr. Shapiro became a vegan lifestyle coach and educator so that she could teach people the skills to help themselves through adopting a healthy vegan lifestyle. Dr. Shapiro also completed the Ruby course for whole plant foods cooking so she could guide her patients through the transition to a healthier and happier life. Furthermore, she is a diplomate of the American Board of Lifestyle Medicine. As a professional health coach, Dr. Shapiro is in a unique position to clarify issues related to diet and the well-being of the body, especially with regards to women's health and breast cancer.
I'm so glad that we're getting to talk about this because I cannot tell you how many times I've talked to women who have had breast cancer diagnoses or are worried about breast cancer, and they tell me that their doctor tells them they can't have soy and that they stay away from soy. They're not even really sure why, but they stay away from soy. And so let's clear this up. Soy, whole soy foods, we're talking about tempeh, tofu, and this is organic, edamame, soy milk. These are minimally processed whole soy foods, are extremely healthful and will reduce your risk of breast cancer.
According to the American Cancer Society, in the United States alone, it is estimated that 281,000 invasive breast cancer cases will be diagnosed in 2021, and 43,600 women will die from this disease. Dr. Shapiro finds that she often has to clear up the non-factual information regarding soy foods consumption and the condition.
So we're talking about a diet that's centered around whole plant foods. And then there's certain foods that you should really up in your diet if you want to particularly reduce your risk of breast cancer. And those would be soy products, whole soy foods. They will not increase your risk of breast cancer. They will also decrease the risk of prostate cancer in men. Now, initially, when studies were being done on soy, and especially on the soy phytoestrogen, they found that soy has something in it called isoflavones.
Isoflavones can be found in many plant-based foods, such as chickpeas, fava beans, peanuts, pistachios, and diverse fruits and nuts. But they are found in especially high concentrations in whole soy products, such as tofu, tempeh, miso, and soy milk. Isoflavones are a kind of plant estrogen known as phytoestrogen. However, they do not behave the same as the human estrogen hormone, which is known to be related to breast cancer in women. Dr. Shapiro explains how these isoflavones, or phytoestrogen, interact with the human body in beneficial ways.
We have two estrogen receptors in the breast and in other hormone-sensitive tissues. We have estrogen receptor alpha and estrogen receptor beta. And it turns out that mammalian estrogen sits in the alpha receptor and it accelerates growth. It's a growth-promoting hormone. That's what it does. But the phytoestrogens, the isoflavones, sit in the beta receptor primarily. And it actually puts the brake on growth. It's sort of an it actually modulates the growth and reduces the growth. So it actually protects against breast cancer. So eating more soy, especially early in life. So if you can actually start your baby off on breast milk and then move to soy milk, you can see almost a 50 or almost 60% decrease in breast cancer later in life.
Dr. Shapiro further elaborates on following a plant-based diet and a lessened risk of breast cancer.
When women eat a plant-based diet in general and more soy, they're going to see a 30% decrease in breast cancer anyway. But if you start earlier, even better, because you can even turn your body into something called an equal producer. And an equal producer means you get more of the benefit from soy. And we see that in people sort of in Asian countries where they grow up eating a lot of soy. They are these equal producers, and they actually make something that actually further reduces the risk of breast cancer.
Whole soy products containing high concentrations of isoflavones can help create the further beneficial effect of producing equal in the digestive system of the human body. Not everyone has the bacteria required to transform isoflavones into equal, but a study found vegetarians are 4 times more likely to be able to produce equal compared to non-vegetarians. In addition to mitigating menopause symptoms, equal has other health benefits, such as increasing bone protection and reducing the risk of prostate cancer in men. Depending on environmental factors such as diet, human DNA can express itself differently. Dr. Shapiro takes us to explore the benefits of soy from a genetic perspective.
We know that some women have mutations in the gene that codes for DNA repair. For example, the BRCA gene. BRCA mutations, they're BRCA1 and 2. What it does is it codes for DNA repair. It repairs DNA, which is constantly being damaged by oxidative stress and inflammation. So if you have a defect, if you have a mutation in that gene, you're not going to be able to repair your DNA as well, and you're more at risk for breast cancer. Well, soy isoflavones upregulate the gene for DNA repair. So even if you carry that BRCA mutation, if you eat more soy, you're going to get more DNA repair, genetically speaking.
In addition to soy promoting DNA repair, Dr. Shapiro reveals how an estrogen-reducing pharmaceutical drug and isoflavones in soy share the same therapeutic mechanism.
Lastly, there's another class of drugs that we give women after breast cancer to prevent a recurrence, and they are called aromatase inhibitors. Aromatase is an enzyme that takes androgens and makes them into estrogens. So we use aromatase inhibitors, like Arimidex, for example, is a common drug, to lower your circulating estrogen so that you will have a lower risk of a recurrence of breast cancer. Well, it turns out that the soy phytoestrogens, the isoflavones in soy, as well as resveratrol and all as lignans that are in flax, they also act as aromatase inhibitors. And so that's how they decrease your risk of breast cancer.
Attentive and bright-hearted viewers, we are very happy you could join us today as we explored the health benefits of soy. We thank Dr. Shapiro for speaking with us and for her in-depth and beneficial work regarding women's health and the vegan diet. With a smile in our hearts and a tranquil mind, we await your presence on Saturday, July 17th for Dr. Debra Shapiro, Vegan, Champion of Women's Health, Part 2 of 3, where she will discuss why we should avoid dairy milk. For more information about Dr. Shapiro and her work, please visit anewviewoffood.com, pregnancyadvantage.net. Wise viewers, thank you for your company on today's program. Up next is Practice More to Know Our Inner Great Power, Part 5 of 5, on Between Master and Disciples, right after Noteworthy News. May you forever enjoy the blessings of God.
Our programs offer many languages. Please visit suprememastertv.com/schedule and suprememastertv.com/HL.
Vegan side effect? You will be smarter.